This is Isha Ward, date of birth 11/19XX. She has allergies to latex and hydrocodone. She's a full code status, and it looks like she's due for her morning medications. I'm just going to review her orders quickly. It does look like I'm going to be giving her the heparin sodium today, which is active and due now, 500 units daily, subcutaneous. With heparin, I'm just going to review her vitals. It does look like she's considered to be a little bit high in a few ranges, and her O2 is low at 92%. This also states that her pain is at a 6, but that should be taken care of since we gave her the ketorolac. Her allergies, both latex and hydrocodone, result in a rash reaction. Her labs, I would ideally like to look at an APTT, but since we don't have that, I'm going to look at her INR. It's a 3.0, which is considered to be a therapeutic range for someone who is receiving heparin. Her PT is a little extended at 15 seconds. We're not so worried about that because we're not giving her warfarin at this time. So I'm just going to see what dosage of heparin we have available. Okay, this is heparin. It is available in 1,000 units per ml. So I'm just going to do some math. We desire 500. We have 1,000 times the volume of 1 ml. 500 divided by 1,000 is 0.5 times 1, which is 0.5 ml, and that is a dose we're going to be giving the patient. Since this is a high-risk medication, I'm going to have my nurse verify that I did my math correctly.
Yep, that looks great.
And while I have this, I'm just going to do my first med check. This is for Isha Ward. She has an order for heparin sodium, 500 units daily, subcutaneous, which is active and due now. She does have allergies to latex and hydrocodone, but this should not interfere in any way. This is heparin, 1,000 units per ml, which is intact and does not expire until 2031, so we're all good there. Let me grab the rest of my supplies. This is my 1 ml syringe, which is unopened, intact, and not expired. And my 25 gauge 5/8 needle, which is also intact and not expired. Knock, knock.
Come in.
Good afternoon, Isha. My name is Isabel. I'll be your student nurse today. How are you?
I'm fine. How are you?
I'm good. Thanks for asking. Can I just have you verify your name and your date of birth for me?
Isha Ward, 11/19XX.
Great. That's what we have as well. Can I just chat with you about any allergies really quickly?
I'm allergic to latex and hydrocodone.
Great. We do have that in our chart, but I just wanted to double check a few other things. What about any betadine or iodine? I'm sorry, I had to move your belongings out of the way.
No, that's okay. No, I'm not allergic to either of those.
Great. Any adhesives?
No.
What about sulfa?
No.
Food or environmental allergens?
Nope, not that I know of.
Okay. And what about any other medications?
No.
Okay, great. So I came in this morning or this afternoon. I'm going to be giving you your heparin. You have had this before. We have in our chart that we gave it to you on your left lower abdomen yesterday. Does that sound correct?
Yeah, that sounds right.
Okay, great. And I know you've heard this before, but we just need to go over some concerns that could be raised with heparin as well, okay?
Okay.
So with heparin, it is a blood thinner, so that it's going to stop any clots that you have currently from growing bigger or any new ones forming. It's also known as an anticoagulant. With this, it does put you at a risk for abnormal bleeding. So if you see any abnormal bleeding, such as when you're brushing your teeth, random nosebleeds in your stool or your urine, please let us know, along with any bruising or anything like that, okay?
Okay.
And then also you could experience some shortness of breath, chest pain, weakness, sudden dizziness or numbness or tingling. If you experience any of those, please just let us know so that way we can intervene immediately, okay?
Okay.
Also, with the injection site, it is normal to have, some soreness after the injection, but if you experience any severe pain, tenderness, redness, swelling, anything like that, please let us know as well, okay?
Sounds good.
And with heparin, it can make you a little bit dizzy or weak. So if you need to get up for any reason, please just press your call light, and me or another nurse will come and help you with whatever you need, okay?
Okay.
Great. So before I give you this medication, I do just have to establish a baseline vital for you, okay?
Okay.
And this cuff is latex free, so we don't need to worry about that.
Thank goodness.
Yeah, we don't want you to have any rashes.
No rashes.
So I'm just going to lift up your sleeve if that's all right.
That's fine.
All right, and that is right on the brachial artery. That's perfect. I'm just going to sanitize my stethoscope really quick. That way we don't have any spreading of any germs.
Ah, seems smart.
Okay, Isha. Great, it does look like your blood pressure is still sitting at 132/90, so it's appropriate for us to give you this medication. Just gonna take this off of you. And then I'm just gonna take a pulse for 30 seconds, okay?
Okay.
All right. And it looks like your pulse is still at 88, so that's fantastic, and it is appropriate for us to give you this medication, okay?
Huzzah.
So I'm going to perform my second med check and get your medication ready, okay?
Okay.
Okay, so this is Isha Ward, date of birth 11/19XX. I have an order here for heparin sodium 500 units daily subcutaneous, which is active and due now. She does have allergies to latex and hydrocodone, but this should not interfere in any way. Great. Awesome, and it looks like that popped up, so I'm just going to make sure. All right, great. The orders match what we're going to give. So I am just going to prepare the medication. I'm going to open the vial first and sanitize the top. While I'm letting that dry, I am going to open my syringe and my needle. Again, it's not tampered with or expired. I'm going to open my needle as well, which is also not tampered with or expired. Twist that on there. I'm going to remove the safety, pull off the cap. We'll put that on there. And then I'm just going to draw up 0.5 milliliter of air just to make the draw up a little easier. Making sure I'm not getting any air bubbles. Okay, and since this is a high-risk medication, I'm just going to have my nurse verify that this is the correct amount.
Perfect.
Great. And then I'm going to recap the needle using the scoop method because it is still clean. Okay, Isha, are you okay if I pull down the blanket and lift up your gown?
Yeah, that's fine.
All right, thank you. Just gonna assess your skin really quick. I do see where you got that injection yesterday on the lower left side, so we're going to move to the right side about 2 to 3 inches away from your umbilicus or your belly button, just to make sure that we're far away from that last injection site. The skin is warm, intact, there's no redness, any signs of any other injections, no rashes, no nothing like that. So that's great. I'm just going to sanitize and put on my gloves. These are also latex free, so don't worry about that. Okay, and then I'm just going to clean your skin. I'm going to clean it about 2 to 3 inches from the inside out. Making sure I don't cross-contaminate anything and that it dries. While that dries, I'm going to perform my third med check. This is Isha Ward, date of birth 11/19XX. She has allergies to latex and hydrocodone. She is getting 500 units or half of an ml of heparin subcutaneously, which is active and due now. I'm just going to uncap the needle. Okay, and then it looks like I can grab about 2 inches of that skin, so I'm going to go in at a 90-degree angle, okay?
Okay.
All right, sharp poke, 1, 2, 3. And I'm going to administer the medication slowly. How are you doing?
Fine.
Okay,
That wasn't so bad.
good. Better than the last one I gave you, huh?
Yeah.
And then I'm going to hold for 10 seconds.
A much smaller needle, that's for sure.
Yes. And it doesn't look like you had any bleeding, which is great.
That is good.
So I'm not going to give you a Band-Aid, all right?
Okay.
Okay, Isha, let's get you all tucked back in. And I just want to remind you about any of those side effects, the chest pain, dizziness, weakness, shortness of breath, abnormal bleeding, anything like that, okay, please give us a call. Same with the injection site. If anything seems abnormal, any redness or swelling, please give us a call with your call light, okay?
Okay.
And again, also, if you want to get up for any reason, please just give me a call so we can prevent any further injury, okay?
Okay, sounds good.
Perfect. And then I'm just going to give you your belongings back. Is there anything else I can do for you while I'm in here?
No, I don't think so.
Okay, great. Then I'll be back in about 30 to 60 minutes to get another set of vitals on you just to make sure that everything's looking good, okay?
Okay.
Great. Thank you, Isha.
Thank you.